First of all, what is TMS? TMS stands for transcranial magnetic stimulation. And essentially, TMS is a revolutionary new approach to treating the brain, especially psychiatric and some neurological conditions. TMS really is a treatment for the 21st century and doesn't involve any medications. It's been designed and proven scientifically to be effective for people who have not responded to conventional medication treatments or therapy. What do people feel during TMS? During TMS, people might feel a moderate tapping sensation on the skull. It's actually an illusion because nothing is physically touching the skull. It's just as the magnetic field passes through the skin and the scalp, it activates the sensory nerves that fool those nerves into believing that they're actually being touched. So it's quite benign, and most people find it a little bit unusual at first, but then quickly acclimate to it and don't notice it very much after a few sessions. The sessions do not induce any kind of impairment, so patients have no problem being able to drive themselves to and from the treatment. And the treatments, usually are, don't interfere with their ability to, watch a show or read something all the while. So you be fully functional during the treatments. How does TMS work? TMS works by focusing a pulsating magnetic field at areas of the brain that we know are not functioning in a certain condition, like depression or anxiety or OCD. And specifically, treating each of those conditions would require targeting different areas of the brain. You can think of TMS like physical rehab for an injured particular muscle group. And in that way, we use, rather than exercises, we use a pulsating magnetic field to cause the brain cells in the circuits that are not functioning well to be exercised, forcing them to be stimulated. And over time, they strengthen and make stronger connections with each other. When that happens, we see the symptoms of depression and anxiety, or whatever we are treating, start to abate, and patients start to feel their symptoms are reduced. In TMS, we target areas of the brain that through research have been demonstrated to be functioning abnormally and therefore contributing to the symptoms of a given condition. When it comes to depression and also anxiety, the area of the brain that we target based on that research is on the left side towards the front. And on my skull, that would be approximately this area. It goes by the name of the left lateral prefrontal cortex, or sometimes called also the left dorsolateral prefrontal cortex. There are other areas that can be targeted to improve symptoms of depression, but this is the most researched and also the one that has the longest FDA approval. What is involved in TMS therapy? Well, basically, TMS therapy involves daily sessions that are relatively short. They may be from a few minutes up to a half hour typically, depending on the protocol. They involve just setting up a coil. In the case of our device, it's more like a helmet. The coil is the part that sits against a person's skull and directs the beam of pulsating magnetic field to target those brain circuits that we are trying to strengthen and enhance. TMS requires in-office treatment, and it's typically done on a daily basis, Monday to Friday for 6 weeks, often followed by 2 or 3 weeks of reduced frequency before stopping altogether. What areas of the brain do we target in TMS? In TMS, we target areas of the brain that through research have been demonstrated to be functioning abnormally and therefore contributing to the symptoms of a given condition. When it comes to depression and also anxiety, the area of the brain that we target based on that research is on the left side towards the front. And on my skull, that would be approximately this area. It goes by the name of the left lateral prefrontal cortex, or sometimes called also the left dorsolateral prefrontal cortex. There are other areas that can be targeted to improve symptoms of the depression, but this is the most researched and also the one that has the longest FDA approval. Are there differences in the different TMS devices? There are definitely differences between the different TMS devices. In fact, you can think of all the devices that are FDA approved, which are about 7 or 8 at present, divided into 2 categories based on the particular type of coil that they use. All but one of the devices use a standard coil called the figure of 8 coil. The figure of 8 coil is an older coil. It works quite well, but it has serious limitations, and those limitations are the fact that it's not able to penetrate very deeply into brain tissue, and therefore it only stimulates a very limited amount of the brain area that we are targeting for rehabilitation. It also only is able to stimulate a small circumference area in the area that we're trying to target. And therefore, it's quite possible to miss the optimal area because it's slightly individualized from patient to patient. There's one device called the Brainsway Deep TMS device that has a patented coil design which came out in the year 2013 as FDA approved, and to some extent overcomes those limitations of depth and circumference. The Brainsway coil, which is called an H coil, is able to stimulate larger volumes of the brain area that we're targeting, both by going deeper and by going wider. And recently, a head-to-head comparison between the figure of 8 coil and the H coil conducted in Europe demonstrated that patients who were assigned to get treated by the Brainsway H coil actually had better outcomes and also somewhat faster outcomes. At Kadima, we now use the Brainsway H coil and have been using it for the past almost 10 years now. I was the first one to adopt the H coil when it came out, as I was the first one to start offering TMS in 2008 when the first figure of 8 coil came out. Seeing differences in the 2 devices, I stopped treating patients with the figure of 8 coil device and have since exclusively gone with the Brainsway H coil, feeling that patients get stronger rates of improvement with that coil. What is accelerated TMS, also known as the SAINT protocol or the SNT protocol? The SAINT protocol is a type of stimulation procedure for TMS that produces somewhat accelerated and possibly higher rates of efficacy compared to the original, more standard approach. In the same protocol, rather than a single session a day over 6+ weeks, patients are given 10 sessions in a day over 5 consecutive days. The same protocol is relatively new, and while very exciting, doesn't have the historical body of multiple positive studies that some of the other procedures have. Nevertheless, the limited studies that have been done are very auspicious and promising, and actually demonstrate faster and higher rates, sometimes close to 90% improvement in patients that receive it. So we do offer it at Kadima under certain circumstances, but are keeping a close eye on its development to see if it will continue to demonstrate some aspects of advantages over the standard protocol. What is theta burst stimulation? Theta burst stimulation is a relatively recent magnetic firing pattern or protocol used in TMS sometimes to produce the stimulation and therefore the strengthening of the brain circuits. It is a pattern that involves faster magnetic pulses, but the overall course of a session is shortened. At present, there is evidence that theta burst stimulation can work as well as the standard protocol that's been approved since 2008, which involves a different pattern of firing. So it's a new alternative to use for some patients, especially if time demands are a limitation.